Now, no longer do you have to go under a knife for a schnazzy schnoz. A simple shot of Restylane can actually help define the face and get rid of that nasty nose that you may think you have without surgery. Joining us now to talk more about the knifeless nose job is Dr. Stephen Davis from Davis Cosmetics Plastic Surgery. Welcome.
Good morning.
What exactly is this? So people want to get their nose fixed. A lot of people want to get cosmetic surgery, but you say that they can possibly do this, or at least get an idea of what they would look like without ever having to go through surgery, without having to go under the knife.
That's exactly the concept here. It gives the patient an opportunity to see what they're going to look like before actually having the surgery, and in a lot of cases, that's enough for them. They don't really want to even go to the next step.
Well, what exactly are you using? You're using something called Restylane?
We use Restylane in this patient, but these facial fillers now are what we call hyaluronic acids, which our body already produces, but it's a synthetic version of it.
Facial fillers? Facial
fillers for, wrinkles, for enhancing lips, for doing all different types of things, but an innovative way of doing a rhinoplasty in this case is to actually put some of this material in and create more of a scaffolding or more of a structure to the nose.
So what exactly are the benefits? Let's take a look at some of the pictures of some of the procedures you have done with Restylane, and explain to us, as we're looking at some of the pictures, the benefits here.
The benefit here is that this gentleman had an opportunity to see if we were going to do the actual procedure. He didn't like the idea that he had more of a scoop to his nose. So he was going to go under the knife, as you call it, to take some cartilage from his nose or from his ear and actually lay it as a graft over top of the bridge of the nose.
It doesn't look like anything's done to me. I don't know if any of the viewers...
It's a very subtle
Around
thing.
where? Around the tip of the nose?
No,
or
right
around
on
the nostrils?
bridge. Right on the bridge of the nose. You can see how it starts to come up, and I hope they have the other picture, because you can see from the front view that it does create a difference in the way the cheeks and the chin and everything else will start to look. And the beauty of this, again, is that the patient can actually participate in his own results.
So he can say, look, I want more, I want less, or I don't like it, let's stop, let's go back to the way it was.
It's done in the office under a little bit of local, and as I inject it, I can give the patient a mirror, and they say, you know what, put a little bit more here, put a little bit more there, and they can actually participate in their final results.
Cost, and how long does it take?
Somewhere probably between $600 and maybe $1,500, depending on the volume and the amount that you need. And it will last somewhere between 12 to, I'd say maybe 9 months to 2 years, depending again on the look that they're going for.
And of course, now we have to point out that this is probably not covered by insurance.
No, it's not, unless, of course, we're talking about significant scarring or other kinds of things that may happen from trauma or other accidents, where you could use the same kind of a facial filler for that.
What are some of the risks involved in this?
It's very minimal. I mean, it's a needle, and it's a topical anesthesia, and the product itself, again, as I said, is like a synthetic version of what our body already makes, so you're really not going to be allergic to it.
Now, a lot of people get Botox done. Now, these are the benefits. You say that it avoids the surgical process, topical numbing.
That's all that's required.
Right, and the patient sees immediate results, and injections just takes a few minutes. So for example, you would take this.
Right.
If I wanted to get rid of the coy, world-famous Caribbean schnoz, you would do what?
What we would do is actually inject more along the bridge of the nose and actually rotate the tip up. Because as we get older, the nasal tip starts to drop or sag a little bit. So we wouldn't actually put it into the nasal tip, although you could. But the concept would be, by injecting it along the bridge of the nose, it would actually rotate the tip up and kind of balance out, as you're calling that Caribbean schnoz.
Well, the coy, famous nose. But if I wanted my nose to look like yours, this is not it.
You don't want that.
But
a nice nose. If you want to, if you're trying to get a smaller nose, this is probably not the way to go. But this is a way of balancing out a curve to the nose, balancing out a scoop to the nose, someone that has a divot in the nose from maybe even a skin cancer resection, and they need to do something, and avoids the surgical procedure.
All right, an interesting idea for those who are interested in trying it out. Dr. Stephen Davis, Davis Cosmetics, we want to thank you for joining us this morning.
Thank you.
All right, let's toss it over.